in terms of the history of Parkinson's treatment, we're not the first generation of clinical researchers to be thinking about providing a cell therapy for Parkinson's disease. So actually, there's a pretty rich history of transplantation in Parkinson's that dates back to the 1980s. So we've been able to learn quite a lot from that. Back in the 80s, for example, various groups across the world had tried using autologous tissue that was harvested from a patient's own adrenal gland. And that was to harvest dopaminergic cells and use those to transplant into the brain. Now, it's a very invasive procedure to do the harvest, and the benefits were modest at best, so that didn't get continued forward. However, around the same time in the 1980s, there was a series of clinical studies. It actually started in Lund, in Sweden, in which they used a different cell source. They used an allogeneic cell source that was derived from human fetal ventral mesencephalic tissue. And these fragments of tissue, or this very small area in the fetal mesencephalon, actually contains, among others, precursors of cells that are going to become the authentic dopamine-producing cells in the substantia nigra in the child and in the adult. And with encouraging preclinical studies, they were actually then able to go on in a number of open-label studies in small numbers of patients and show that it was feasible and it was safe to do the transplants. The cells would survive. They could actually image the cells using markers for dopaminergic cells, and that in some patients they could actually get clinical benefit. So it was encouraging enough that by the 1990s, two groups actually started sham surgery-controlled clinical trials using that same type of tissue, the fetal ventral mesencephalic tissue. And these were incredibly carefully done studies. One was led by Kurt Fried, one was led by Warren Olanow, and they were published back in 2001, 2003. And although those studies didn't meet their primary endpoints, they were hugely beneficial for the field in multiple ways. First of all, they could show that this, again, it's feasible and it's safe to make the transplant. Second, they could show with very rigorous imaging procedures that you could get some persistence of the engrafted cells, and they had dopaminergic markers or function. And then third, although they didn't meet the primary endpoints, they could find subsets of patients within the cohorts who actually had derived some clinical benefit. So actually, even today, going back to those studies, there's an ongoing study called the TransEuro study in Europe, led by Roger Barker, in which using an optimized clinical trial design based on what was found in those studies, they're going ahead to test again what could be the benefits of these fetal tissue sources. So that's where we take off with our story, because obviously there's some evidence with the fetal tissue that it could be beneficial, but there are just so many drawbacks. And with the advances that have been made in stem cell technology over the past 1 or 2 decades, we're really in the position now where it should be possible to grow an unlimited cell source, be able to differentiate those cells into something that is, to all intents and purposes, an authentic adult midbrain substantia nigra dopamine producing neuron. And with unlimited cell sources, you can envisage the situation in which you could produce banks of cells that could almost provide like an off-the-shelf therapy eventually for people with Parkinson's. And you would have the advantage that these cells would be derived under incredibly controlled conditions. They'd have really rigorous quality control, rigorous release criteria, and all of the preclinical work that's necessary to bring a therapy like that to the clinic could actually be done in terms of tumorigenicity assays, in terms of efficacy, and so on and so forth. That could all be done in the same cells as are actually going to be transplanted into people with Parkinson's.